So this is a simple health monitoring system. You can use it to measure temperature, heart rate, blood pressure, the systolic and the diastolic. Now, this system has two ways of giving output. It can output through giving the raw reading for the temperature, heart rate, and blood pressure, and also giving you the signal waveform. You can also send an alert, a beep, or a signal, light signal to the healthcare giver or to whoever is in charge. The patient is in danger. Now, these are vital signs that are usually measured for many patients in health clinic, majorly ICU. So, the temperature, we have the temperature measurement equipment and then the output buffer. So this temperature is programmed to go measure a higher temperature and a lower temperature. Now, if the temperature is above 38, there's a fever alert. That means the patient is in danger of a fever. Then if the temperature is below 34, that means the temperature is low, and then the patient is suffering from hypothermia. Now, whichever way, this system is going to send an alert, a signal alert, which is this button. Now, for the heart rate, this is the heart rate measuring equipment. Now, it also happens that for the heart rate of a person is between 60 and 100. So above 60, the machine is going to output. Above 60, it's going to be normal. Above 100, machine is going to output a very dangerous a signal saying that the person is in danger. Below 60 is still an alert that the patient is in danger. Now, for the blood pressure, the systolic and the diastolic. The systolic is between 90 and 140. The diastolic is between 60 and 90. So if the blood pressure should go above 140 for the systolic, there's going to be an alert, a red alert. Now, below 90, there's going to be a red alert also. In between, we have normal. Now, also for the diastolic, above 90, there's a red alert, and below 60, there's a red alert, and in between is normal. Now, what this display display the signal itself, what the temperature reading, the heart rate reading, the blood pressure reading, and so on. Then this will give us the waveform. Then this signal button is going to tell us if the temperature is above normal. If any of these vital are above normal, you are going to have a red alert here. Now, if they are all normal, we have a green alert here that saying that they are normal. Then you can also read the health professional and read the vitals here. Now, why this is there is to ensure that both the health professional and the relative of the patient can monitor the health of that patient. It is just a simple system. So this temperature, if it goes above normal, you get your red alert. Any of the system that goes above normal is a red alert. They all just one, or if anyone at all goes above normal or below normal, you have a red alert. Now let's simulate the system to see. First of all, we are going to simulate in the normal condition if the patient is normal. So in a normal condition, you can see that we have a green alert. It shows that the patient is normal. Now, the output is reading 0. So because of this output is 0, the patient is normal. Temperature is 37, which is normal. The heart rate is 82, which is normal. We have the blood pressure 120 over 80, which is normal. Now, if we should increase this temperature, let's say that our temperature signal, increase it to 39. Now that means the equipment is now measuring 39 degrees Celsius. We can simulate and see that the temperature is 39 degrees Celsius. Now you can see that we now have a red alert. There's a fever alert now. The temperature has increased. You see that this signal, you can see the signal reading from here, from this dashboard. So this alert now shows that the temperature has increased. Now if we go back, let's say, okay, the heart rate, you can also increase the heart rate or decrease the heart rate. Now if we increase the heart rate, let's say 44 plus now you can see heart rate has increased drastically. We now have 159 BPM. So that shows that the signal, you can see the signal already is bad. Okay, so it's showing that this is a red alert that this is bad. The patient is above normal, way above normal. Okay, so let's go back and let's take the temperature back to normal. So let's take the temperature back to normal. And the heart rate, let's take it back to normal. And then we increase this. Now it's 120 for systolic. Now we'll make it 130. Over, so this is the 90, so we'll make it 130 over 100. So you see that this is normal, then we have 130 over 100, and you can see that, okay, very well, we have a red alert system. So whichever one is abnormal, you are going to get a red alert system. The health professional can just see from this data that there's an abnormal condition, while the patient relative or the health professional can also get an alert that it's red now, something is wrong. Then you have to check on the patient. So this system is a very simple system, small and simple system, and I want to run it again as a normal, under normal condition. So if we have our normal condition, let's see that everything is back to normal. Everything is back to normal.